My name is Orande Miller, and I'm a senior associate here at the Center for the Study of Social Policy and also the coordinator of the Alliance for Racial Equity and Child Welfare. On behalf of the Alliance and CSSP, I'd like to welcome you to this afternoon's webinar focused on the critically important role of social service administrators in promoting racial equity in child welfare and human service systems. The webinar will get started shortly, but just a few brief and important reminders. First, we recommend all participants dial into the webinar using a landline to improve your sound quality and to avoid any connectivity issues. If you do have any issues with sound quality, we ask that you please hang up and then dial back in, and that usually fixes it. Questions for our presenters will be answered at the end of all the presentations. You can submit questions anytime, however, using the question feature in your GoToWebinar control panel. Also, just to note that this webinar is being recorded and will be publicly available after the webinar. The link to the online webinar recording will be shared with all who registered for today's webinar via email after the webinar. I'll also note that we will be sending the combined set of PowerPoint presentations as well with the link after today's webinar, in addition to an evaluation survey. And so we appreciate all the feedback that we get after each of the webinars, and it's really, really important to help us make sure that we're responding to the topics that are of interest to folks who are out in the field, and also to make sure that the process and the experience is a good one for all who participate. The mission of the Alliance for Racial Equity and Child Welfare is to promote leadership and provide information in support of eliminating racial disparities and improving outcomes for children and families of color who are involved with this nation's child welfare system. One of our primary goals is to help individuals and organizations further understand the nature of and the extent of the racial disparities we see in outcomes for children and families who are involved with the child welfare system. And because we ultimately want better outcomes for children and families, we like to highlight examples of agencies, organizations, and in this case, administrators that are actually making the practice and policy shifts that are necessary to contribute to those improved outcomes. One of the things that we like to note and highlight today is the start of what we have developed as an alliance network of social service administrators. And I won't read the entire description, but the purpose of this network is to facilitate a community of child welfare and social service administrators that are all committed to achieving racial equity among children and families who become involved with each of their respective systems. And so we ask that any administrators, child welfare, social service administrators that are interested in being a part of this network, please reach out to me directly, Orande Miller at CSSP, and we'd love to have your participation. And so the involvement will revolve around information sharing, largely through a regular series of conference calls that will be led by and facilitated by and kind of shaped by the interest of administrators. And so we look forward to your participation for all who are interested. During today's discussion, we'll be looking at the important role of child welfare and social service administrators in promoting racial equity within this nation's child welfare and human service systems. To share their experiences and perspectives, we've invited 3 experienced and effective leaders who have made and continue to make important contributions in advancing racial equity and improved outcomes for children and families throughout this country. First, we'll hear from Joyce James. Joyce is a racial equity consultant and the former Associate Deputy Executive Commissioner for the Texas Health and Human Services Commission Center for the Elimination of Disproportionality and Disparities. Prior to that role, Joyce was the Deputy Commissioner of the Texas Department of Family and Protective Services. Joyce is also a member of the advisory group that guides the work of the Alliance. Then we'll hear from Janice Frandell. Janice is the former Deputy Commissioner for the Connecticut Department of Children and Families, who continues to promote this work as a consultant and also as a member of the advisory group that guides the work of the Alliance. Then we'll hear from Gregory Owens. Greg is the Director of Special Projects at the New York State Office of Children and Family Services and has been a great expert resource for CSSP and the Alliance's more intensive focus on the experiences of African American males and also for the Alliance's work more broadly. And so we appreciate each of you all joining us today, both the 3 of you who are serving as panelists as well as all who have joined as participants for today's webinar. To get us started, we'll ask Joyce James, and then she'll be followed by Janice Brundell, and then Gregory Owens. Joyce?
Yes, good afternoon. Thank you, Aronde. Good afternoon to everyone. I'm pleased with the opportunity to present as one of the panelists for this webinar because it is a topic that is very near and dear to my heart. We've been talking about disproportionality and racial inequities for a very long time. However, I still have hope and belief in our ability as social service administrators and human services professionals to keep this journey moving forward and to be in a place where we can realize our vision for this work. Next slide, please. I am going to be presenting from a term that I coined as the groundwater approach. And I'm going to start my presentation by sharing some of the key observations about racial inequities. And I'll just quickly read those off because I think they're very critical to the discussion around understanding racial inequities. So they look the same across all systems. Systems contribute significantly to disparities. We know from research that disparities cannot be explained by the presence of a few bad apples. We also know that poor outcomes are concentrated in poor geographic communities, usually communities of color. And we also know and have evidence that systemic interventions and training can work to change thinking and to reduce disparities and improve outcomes for all populations. What I want to say before we move any further is that important to the discussion that we're having today, I believe that we must be clear about the fact that social services and human services administrators must seek to first understand how and why racial inequities exist, because we cannot promote racial equity with the same attitude and assumptions and through the same lens that contributed to the inequities that have been in place for so long. And so bottom line is we cannot promote something if we do not understand it. And history tells us that we can no longer rely upon the fact that we are all well-meaning, which we are. I wholeheartedly believe that, and the fact that we are well-intentioned people who deeply care about our work and about the outcomes for everyone we serve. Because what we know is that in spite of our good intentions, the outcomes remain, and disproportionality and disparities exist for the same population in all of our helping systems. So I want to talk about it in that groundwater approach, and I'll talk more about that as we go on. Next slide, please. The next chart that you will see just really speaks to the fact that different systems have developed different terminology and terms in which to describe their racial inequities. And I won't go through all of those other than to say that in child welfare, we talk about it in terms of disproportionality. In health, we refer to it as health disparities. We speak of disproportionate minority contact in juvenile justice, the achievement gap in education. But one of the things that we have to understand that to promote racial equity in any one of these systems, we have to understand why these inequities are showing up in all of these systems and come to understand that groundwater approach that I spoke of. And the groundwater approach says that we must be doing work in all systems that touch the same vulnerable populations. And that is due to the analogy that if you don't do work in all of the systems, then you stand the risk of repeated contamination at the groundwater level. And so, understanding of these issues can have the impact of shifting our thinking away from, where with commonly held beliefs that the burden and responsibility for racial disproportionality and disparities lies with the individual. And hopefully seeing in a broader context the fact that inequities exist in all of these systems may have a tendency to move us toward a willingness to do that deeper examination of the systemic factors that hold racial inequities in place. And so it's very important in looking at this to also understand that oftentimes we use the term equality, and that's not in this is on this slide. Normally I would have had equality and equity, which really speaks to the fact that what we are working toward as leaders is equity, and that we should have no assumption that treating everybody equal will lead to equity. And so we have to keep asking the question, what causes racial inequity? And we want to begin to consider the possibility that racial inequity in one system contributes to racial inequity in other systems. And there are some very clear examples of that. We don't have a lot of time to analyze all of it, but one example is that we know that the achievement gap also causes disproportionality in disproportionate minority contact. Also, the fact that disproportionality in disciplinary referrals can often lead to juvenile, which can often lead to the criminal justice system. So to understand that in the broader context is very critical. Next slide. To further demonstrate the connection between racial inequities and their existence across multiple systems for the same population of people, I've taken some measures here from 5 systems. And you will see that child welfare, juvenile justice, criminal justice, and health. And we have 2 measures for each system, and they are listed across the x-axis. And you'll see, for example, that for child welfare, we looked at CPS removals and number of children in foster care. And in health, we looked at preterm birth and deaths from diabetes. And we took all of the measures and turned them into a relative rate indices for a more simple comparison. And the rate index is found across the y-axis. And what it tells us is how many times more likely than a white person is another person to appear in each of these categories. Now, when you look at the measures from all of the systems together, what we find, in my opinion, is really striking, because across all of the measures, African Americans are at least 2 times more likely than whites to have poor outcomes. And on most measures, they're 3 to 8 times as likely to have poor outcomes. When we look at it for Hispanics, what we see is that they're close to whites in some instances, and they're doing worse than whites in other instances. But the fact that African Americans fare so poorly in every system suggests to us that there are some underlying dynamics that cut across all of these systems. Because if we found inequitable outcomes in only some of the systems, it might lead us to look at individuals or to think differently about the why. But what we see here is that in every case, African Americans are doing significantly worse than whites and Hispanics. And therefore, I surmise that systems leaders at all levels of our institutions, that we have to begin to hold ourselves accountable for doing a deeper analysis that would explain why racial inequities exist for the same population at the rate that it does across all of these systems. And so, to me, getting to this new way of thinking requires a willingness to engage in new and courageous conversations. And in conversation which includes a discussion on institutionalized racism. as well as a willingness to do what I refer to as turning the mirror inward and beginning to hold systems accountable for looking inward at those systemic factors that have contributed to the outcomes that are so profound, I believe, in this particular slide. Next slide, please. I'm just going to show you a series of slides here, and what I'm hoping to do with this is to really help us to open our minds up to the idea that there's something going on deeper than what is happening at the individual level. And so just white mothers, for example, without high school education have better birth outcomes than black mothers with a college degree. And we won't do the analysis on that. I'm just going to kind of share a few of those. Next slide. So national education data shows that income does not account for racial inequities. Next slide. Next slide, please. White resumes receive more callbacks than high-quality black resumes. And I'm sure that we have heard of the recent research around how people's names even impact whether or not they're called in for an interview. Low-quality white resumes receive more callbacks than high-quality black resumes. Next slide. So these two, this slide represents some decision points within the juvenile and child welfare system, and it's really just to show that when you look at the population of juveniles or youth in both systems, that what we see is that the inequity increases with each decision point in both systems. So just as an example, when we look at the child population in child welfare, and this actually is Texas data, you'll see that African American children represent 12% of the child population. They represent 21% of the confirmed allegations of abuse, 28% of the children removed, and 31% of the children in foster care. And so at every stage and every decision point, you see disproportionality within these systems. Next slide. Student behavior does not account for disproportionality in school discipline. And this is really a striking report, and one that I would encourage you to read, because even though it's about what happens in the education system, we know the impact that that has on child welfare, not only at the point at which youth are in the education system, but later on when they become adults, that the quality and level of education impacts often whether or not they transition into other systems like child welfare and juvenile justice. So I want to spend just a few minutes on this one, saying that in this study, researchers looked at disciplinary records for nearly 1 million students. And by combining data sets from different agencies, the Justice Center and Texas A&M Public Policy Research Institute were able to examine 83 different variables that fell into the categories that you see here. So they were looking at things like student demographics, attributes, academic performance, discipline contact, campus measures, cohort measures, and country measures. And if you'll move on to the next slide, please. What you'll see is I think, just so profound, in that when they controlled for 83 factors, African American students were more likely to receive discretionary discipline. And I want to read just directly from the executive summary just a couple of things. So the multivariate analysis, which enabled the researchers to control for 83 different variables in isolating the effect of race alone on disciplinary actions, found that African American students had a 31% higher likelihood of a school discretionary action compared to otherwise, and I want you to hear this, compared to otherwise identical white and Hispanic students. What is particularly interesting is that when you look here at mandatory control for these factors, you can see that African American children are actually less likely to commit offenses like aggravated assault or bringing a weapon to school that lead to mandatory action. And so, in my opinion, this is a clear analysis of institutionalized racism at work in the education system. And I want to just add that I believe that it is by well-meaning and well-intentioned educators who do not have an understanding and an analysis of how institutionalized racism manifests and results in these kinds of unintended consequences. Next slide, please. So just to continue with sharing that this happens in a broad spectrum across multiple systems. You know, we just saw data from child welfare, juvenile justice, and discipline. And the same outcomes have been documented at length in other systems, including health. And one of the most authoritative studies was done by the Institute of Medicine. And I won't go into much detail, but I would encourage us to really increase and broaden our knowledge and understanding about what happens in multiple systems for the families and the youth and the children that we see in the child welfare system. Because knowing that in itself has been beneficial in reshaping the lens through which we see people by the time they come into contact with the child welfare system. So in health, for example, research indicates that minorities are less likely than whites to receive needed services, including clinically necessary procedures, even after correcting for access-related factors such as insurance status. And research to date has demonstrated that healthcare providers' diagnostic and treatment decisions, as well as their feelings about patients, are influenced by a patient's race or ethnicity and stereotypes that are associated with them. And so it's just really important to also hear that these stereotypes are held even by people who truly believe that they do not judge others based on social categories. And this kind of thinking applies across other systems. And I think that you know, I can't emphasize enough that I believe that we are well-meaning, we are well-intentioned, and that we don't come to our work to harm, but rather to help, but that we must begin to examine the attitude and assumptions that we have in place that contribute to these outcomes. And so I don't know many people at all you know, who deliberately make these kinds of decisions. And so what we have to start doing is stop asking who or what is racist, because when you start to have these conversations and bring up these issues, then it often shuts down because people think that they're being called racist. And so we believe that we have to stop asking the question, who is racist, and start asking what causes racial inequity. And to answer that question, we have to learn to have conversations about race and racism. And we have to develop an analysis and an understanding of how racism manifests in our systems and our institutions. Okay, so if we can move to the next slide. And this is just an example of something you heard me say earlier, and that is that even when you remove the bad apples If we removed all of the people who outwardly profess to be, openly admit to being racist, it would not change the data for our systems. Because again, it is about well-meaning, well-intentioned people who have to begin to be more accountable for shifting and increasing our knowledge and understanding and examining our box-like thinking around these issues. Next slide. I want to just talk briefly about the model that was developed under my leadership in Texas in response to the data that I've shown you, and specifically in response to the data that we started to examine in the Texas child welfare system, which indicated disproportionality for African American and Native American children. I know from personal experience that if administrators are willing to think outside of the box and to become conscious of the fact that we have conformed and that we have been deeply socialized to expect certain outcomes in our systems for certain populations of people, and that we have to become more accountable for our attitude and assumptions when we say what is broken is the people, and that we have the solutions about how to fix them. I have been in that place. The work that I led, however, in the child welfare system and at the Health and Human Services Commission has given me great hope because of the philosophical and cultural shift that led to a decrease in racial disproportionality and improved outcomes for all populations when the model that I'm about to introduce was put in place. And so these are the components of the model. Data-driven strategies, and I won't spend a lot of time on them other than to say that it's important that we collect all data about race and ethnicity, that it is compared to the racial and ethnic population of a defined area, and that it is examined from a systemic and cross-systems perspective, and that it is shared transparently with systems and the communities that are affected by the outcomes. The role of the piece around leadership development is very significant. I have a whole piece on leadership development that we won't get to go into today, but just to say that leaders have to be grounded in anti-racist principles and in their understanding of their own internalized racial oppression. And so we have to seek to increase our knowledge about why people are poor, and that comes from my history and knowledge that I gained through my involvement with the People's Institute for Survival and Beyond and the Undoing Racism workshop. But I came to understand how profoundly important it is for us to examine our attitude and assumptions and our understanding about why people are poor because of the high percentage of poor families that come to the attention of our child welfare system. Leaders must be not only accountable to their staff and their institutions, but equally important to the people that they serve. And this means then transparency and doing our work with a sense of humility that conveys a willingness to support internally and externally the development of new leaders with the same mindset. And so although we're talking about what must happen for leaders and administrators to do, we have to come to recognize that we have to have leadership at all levels of the institution who share a common knowledge and understanding of these issues, and from which the leader must role model and give the okay for people to work in new and courageous ways. And then we have to have a culturally competent workforce, the importance of valuing the culture of all people we work with, and the recognition that we cannot impose our own values on the populations that we serve. And so as social workers, we can be more effective when we embrace and respect the dignity and worth of all people based on their own unique culture. And then that next piece is on community engagement, and there's a whole 4-stage model on that. I do want to say that it's a real critical component. You know, it's important to bringing about true systemic change, and that the various stages, which I have a copy of in this presentation, you'll get it. I won't get to go through all of it, but the stages support the importance of conveying a transparent message that is critical to developing trust between communities and systems. And it requires engaging the grassroots community through transparency in communication that is respectful. And lastly, what I'll say on this, and there's much more to say about community engagement, is that we have to recognize the community's strengths. And then the cross-systems collaboration. We've already talked some about understanding the relationship that systems have to one another and their collective impact on the same vulnerable populations, and moving away from our silos, which puts up more and more barriers and challenges for families who have to try to figure out how to navigate all of the different systems that are not talking to each other. And so we have to have a more integrated and holistic approach to this work if we really want to achieve equity. Then there's training defined by anti-racist principles. And in Texas, we based our training on the anti-racism principles as outlined by the People's Institute for Survival and Beyond. And they included learning from history, developing leadership, maintaining accountability to communities, creating networks, and undoing internalized racial oppression. The last one here is understanding the history of institutionalized racism and the impact on poor communities and communities of color, and recognizing that this is critical to improving the overall outcomes for vulnerable populations. And so for outcomes to improve, we must understand that history. I'm going to move on to the next slide, and I think I should be quickly getting ready to wrap up. So I want to just give you an example of what can happen when such a model is applied. So an evaluation of the model included the impact that it had when it was applied rigorously to child welfare between 2005 and 2009. And the work started in 5 focus counties. And 2 years later, it was rolled out statewide. The purpose was to reduce and eliminate disproportionality in child welfare outcomes. Next slide. The Texas model led to a statewide decrease in child welfare removal rates from 2005 to 2010. And you can see that over the time that the model was fully in implementation, the rate of removal decreased significantly for African Americans. And in fact, over the period, removals decreased for all children. So when the model was used to address disproportionality, outcomes improved for all children in the state. And this is the ultimate goal of any effort towards racial equity, is that when the system gets better for those who are least likely to have positive outcomes, that it will result in good outcomes for everyone. Next slide. There was no significant increase in repeat maltreatment during this time. And that's often, a fear that people have. If you do disproportionality work, if you focus on keeping families together, and keeping children safely in their own homes, that somehow it's going to put them in more danger. Our evaluation during that period showed that African American children remained safe, and repeated maltreatment did not increase for these children. Next slide. The decrease was most pronounced in those counties where the model was fully implemented. And you can see on the top right that the change in the rate of removal for African Americans and whites in those focus counties versus the change in all states, that the rate of removal for white and African Americans decreased at least twice as much in the focus counties as it did in the state at large. And so it just shows that the model works when applied. Last slide that I'm going to do, because I think I'm out of time here. The last slide, I just want to say that this slide shows the difference in the old thinking and the new thinking around how we work to bring about change. And so we have often felt that the outcomes we see are out of our control, but there is evidence that when the right principles are applied, there is evidence of systemic change. So if we are willing to examine racial inequities at a deeper level, looking at institutionalized racism as the root cause, it is possible to develop a racial equity lens that will shift our thinking and create a movement where communities and institutional gatekeepers can begin to drive a change in outcomes. It's going to take commitment and accountability from systems and communities, but it is possible.
Okay, thanks, Joyce. I know there were a few things that you have as a part of the formal kind of set of PowerPoint slides, and so maybe when we get to the question and answer, you may want to come back and refer to some of those slides. So we appreciate the work that you're doing, and we appreciate your participation in your presentation today. Janice?
I'm there.
Okay.
Okay, this is Janice Grandel. Thank you. I am the former DCF Department of Children, Connecticut Department of Children and Families Deputy Commissioner. I actually served in the agency 3 different times, so I have a pretty long view on some of this work. I do want to thank you for the invitation to participate and to tell all of you that as a member of the Alliance for Racial Equity, it's been quite an extraordinarily strong learning experience for me. So thank you very much. Next slide. Let me tell you what's inside very quickly. I want to show you what people are finding and writing about with regard to disproportionality in Connecticut, not just in child welfare, and that will mirror some of the slides that you've just seen from Joyce. I'll share one set of data with you that we used within DCF to look at a case practice issue. And then I'd like to take a few minutes and describe the actions that are now being taken at all levels of the organization to advance a racial equity agenda. And finally, a few reflections of my own on the role of leadership as we do this work. I do want to call out a very important colleague of mine, Bill Rivera, who's on the call as a listener. He has a long and distinguished history within the Connecticut Department of Children and Families, and he serves as the DCF Director of Multicultural Affairs. You should feel free to Google Bill, William, and follow up on any of the action steps that are now ongoing if that part of the presentation is of particular interest to you. Bill, thanks for being on. Next slide. In Connecticut, I just am using 2 different kinds of examples here. We just went through an extraordinarily rich process led by the Department of Public Health to build our own state Healthy Connecticut 2020 plan. And while the PowerPoint deck for that presentation is like 136 slides long, so you need to have a cup of tea with it. Here is one of the summary statements that pretty much says it all. Connecticut meets most national targets on health. We're actually pretty healthy overall. We have a good profile around health outcomes, well-being outcomes, but there are incredibly striking and dramatic health disparities by age, sex, race, ethnicity, geography, and socioeconomics. You'll remember the slide that Joyce shared with you where she showed us the different language that people use to talk about this particular problem, and also her comments near the end about understanding the incredible correlation with poverty and the challenges of living in that kind of chronic, stressful environment over generations. So what I'm showing you here is our summary that says exactly the same thing with just a ton of data to back it up. And then another statement which I find incredibly compelling because it takes us beyond some of those agencies that are listed. And it's just an overall statement that says, everything we look at in Connecticut, from education, juvenile justice, incarceration, health and healthcare, housing, employment, income and wealth, and then opportunity, economic opportunities. We have these differences in Connecticut that are incredibly striking. This is not a new issue for us in Connecticut, nor new knowledge, and for a very long time people have been talking about this as early, well before this, but a very compelling case was set out on National Public Radio, NPR, with a series of radio broadcasts that talked about the tale of two Connecticut's. And most recently, in March 2014, there was an incredibly rich posting, and you're not going to believe this, on Al Jazeera America that highlighted Connecticut of all the places. So if you're looking at this issue, you can find the representations of this issue everywhere, everywhere. And so the question, of course, is why we still have it. Please, next slide. Here's a data point, one data point from the analysis that was done within the department and presented in 2012, but based on 2010 data. And we were looking at different decision points within the child welfare case practice where data would let us examine outcomes of the practice by race, so what actually happened. And here's one data point. So while 37% of all the children in Connecticut are children of color, within DCF at these various points in the child welfare system, the data very much mirrors the data that Joyce gave us over a broader range of examples. 58% of children of color constituted our abuse neglect referrals, 61% of our substantiations, 60% of cases opened, and 67% of all children in DCF funded placements, whether it was a congregate setting or a family setting. And we calculate these in terms of a disparity index, probably not unlike the way that Joyce described it to you. And in that context, African-American children are 2.8 times, almost 3 times more likely than white children to be referred for protective services for abuse or neglect. And Hispanic children are 2.2 times as likely to be referred. And what we are finding, have been finding, is that at every point within this process, we can actually look at the decisions we make in case practice and then hold them up for comparison against the disparity index. Next slide, please. So the department's current administration, which was appointed by our then newly elected Governor Daniel Malloy, and he was elected in 2010, he took office in 2011, brought in a new administration of folks. Our commissioner stepped off the Connecticut Supreme Court to take the leadership role here, and she built her team from folks who had been on the outside and folks who had been on the inside. Attention to this issue began early in the department, 2005, and experienced a series of starts and stops as administrations changed over time. One of the things Joyce didn't talk about was the challenge of this issue over time in state government is that leadership changes, and it predictably changes, which says, well, top leadership is critical, and it is, and I'd like to show you how she approached it. It's really imperative that it operate at all levels, but that it also focus on leadership among staff and employees who are likely to continue to work there over the time when senior or executive leadership changes. A really critical issue. A note on the department itself. We're one of a very small children and family agencies in the country, so nearly $1 billion, serving children and families within the context of child welfare, children's mental health, substance abuse, juvenile justice, and to a more limited extent, preventive services. This construction, agency construction, gives us the opportunity to look, as Joyce said, across systems within our own agency, which is not as easy as it sounds, and also to look comprehensively around the needs of the family as they are touched by all the other systems. When we came in 2001, we took a good hard look with senior leadership on the agency's mission statement. We revised it and summarized it in a very few a very few number of words. And our expectation is that all children will be healthy, safe, smart, and strong. And there's a lot more words to it, and it talks about the context. But for me, that's incredibly important because it makes Joyce's point that while we have to look at children who are in special circumstances, we need to address practice and policy so that all children actually have better options than many children have when they enter our system. So we did this in 2011. We also established 6 new operating principles for the agency while we were making a substantial areas of child welfare reform. These are shown on the slide in the dark colors, and they're important to understand, so I'm just going to say them for you. We started by saying that family-centered everything would be at the core of what we did, that we would apply the neuroscience of human development that is just so strikingly important about how children learn and how their brains work, and what we know now that we didn't know in 2005 and 1995 and other times earlier. We would expand trauma-informed practice because the impact of poverty and other adverse childhood experience is so incredibly important to how young people grow, how their brain functions, and how they function as adults within society and also as parents. So the intergenerational elements of that are hugely important. We said that we would operate with a data and results framework and very high levels of transparency, that we would build new agency and community partnerships, and that we would become a learning organization. Then, following the identification of ways to actually act in each of those principles, we began again to look at the issue of racial disproportionality within the department and using department data.
Hi, Janice. Are you still there? Janice? Okay. So I think we'll, Greg, if you're still there, then we'll turn to you now, and then if Janice gets back on, then we'll allow her to finish some of her additional remarks.
Hello? I'm back.
Hi,
I'm sorry. Something disconnected me.
Okay.
Can I continue and finish?
Yeah, please do.
Thank you. I definitely apologize. I don't know what happened there.
Okay.
In 2012, we added a specific principle around racial inequity, and in 2013, and work began, and in 2013, a very structured approach using a series of work groups was established. Next slide, please. Next slide, please. Thank you. I mentioned earlier, and I want to say again, that it's imperative that these processes receive the permission, but not just permission, the support and the wholehearted endorsement and belief from the person who sits at the top of an agency. And in 2006, Justice Katz issued the following memo to all staff. I'm going to let you read it. I'll just let you read it for a second. Okay, 2 things for me stand out. One is that while it begins with the essential language around diversity and inclusion, which we all talk about all the time, and actually it's sometimes more rhetoric than belief, it ends, I think, in a very powerful way, actually using the language of racism to say that from this point forward, would become a racially just organization, and that we would oppose and eliminate racism within the context of the agency practice and policy that we could control. I think it's a very brave statement from the leadership of an agency in which children are disproportionately treated. Next slide, please. So here's the structure. I'll get it briefly, and there's one error on it that I want to call out. There are 4 working subcommittees. The first one is on disproportionality and disparities, and that group of folks comprised of representatives from our 14 area offices. That's 6 regions within the state, which means completely statewide. And our 2 institutions, one of which serves children with serious mental health challenges, and the other which serves older adolescents committed to DCF or delinquency males. That is who composes this subcommittee. We have baseline data and are transmitting data reports on progress. So that makes Joyce's point, I think, that you have to start with data. And that everything that the department is doing will be examined through the racial justice lens. I'll give you a concrete example. We had worked very hard on the development of a revised strategic plan. And in the beginning, we didn't have the particular racial justice principle, nor had we had it structured in a very obvious way in the plan. So once we went through this process together, we went back and looked at revisions to the strategic plan, which of course would guide everything that we did going forward. So that's an example of this kind of work. The workforce, as Joyce pointed out, is incredibly important because from caseworkers to supervisors to managers, professional clinicians and the like, people make judgment calls from the very first contact that they have with a child or a child's family, whether that contact is over the phone or on paper or in person. So it becomes incredibly important to look at how our workforce is selected, therefore integrating this into pre-service training, and also how people have the opportunity to engage in a facilitated group process that addresses these kinds of issues. It's workforce from top to bottom in this context. The third subcommittee, which is one I'm really excited that people are doing, begins to look at the statewide contracts we have with service providers at the community and statewide level. So part of this involves transmitting internal data from us to providers that show, that reveal the disproportionality we've been talking about, and also beginning to restructure our contracts so that they begin to require cultural and linguistic competence. This is a huge step forward because what you write down and pay for and measure is the kind of change that you're going to get. And then the last working committee should say agency and community collaboration. I apologize for that. And this allows us to get to some of the cross-system and also the cross-community issues that Joyce raised. Here are a couple of examples. We are looking at adjustments to mandated reporter training to put a racial justice lens on that, because those are the calls that come in from mandated reporters around child abuse and neglect. They're looking at designing a central office awareness initiative, and the reason for that is every single thing we do, from contracts to training, to communications, all of that needs to take into account the goal that we want to have about a reduction of racial disproportionality. And we have in Connecticut a very active and highly regarded community and provider alliance called the Connecticut Juvenile Justice Alliance, and we're partnering them to look specifically at the juvenile justice system, which is significantly more disproportionate than even the child welfare system. I share with you for 2 reasons, 2 points here. This structure is a working structure with representatives from across the agency, top to bottom and bottom to top. So it's not on paper, it's actually working. They actually meet and they're actually grappling with some of the issues of culture and belief and points of view that Joyce highlighted. And secondly, this whole effort is anchored in data. It has to be anchored in data, and that data has to be used to change practice, to change child outcomes, and then also to change the way we fund agencies so that we are engaging more with agencies that have the same belief structure that we do and who are getting the outcomes that we hope to see on behalf of all children. Next slide, please. I want to close with just 2 slides. John Hope Franklin wrote this, and it's been very powerful for me since he wrote it, so for many years. We know all too little about the factors that affect the attitudes of the people of the world towards one another. I'm struck with the image of Ferguson and other places when I read that. It is clear, however, that color and race are at once the most important and the most enigmatic. I think that's important because it calls out the issue that Joyce raised about how much we have to learn about our own beliefs and values and actions with regard to race and color. I will give you a kind of example for me. When I got there, we had the People's Institute come in and begin a 2-day working session for us on white privilege, and it was really hard. I had a good understanding of the data, and I put myself in the category that Joyce described, people who don't believe that they're racist and would never take a racist action. But what I didn't understand was the historical context, the way it was presented, and I had no idea of until I experienced it, of the intensity of our workers of color, our administrators of color, whether they were African-American or Latino, Hispanic, and how deeply held and at what a personal level the issues that we were talking about, what an important position the issues that we were talking about had from them. The 2 days were very hard, and it caused us to stop for a little bit of time and reflect and learn and talk and create a structure where we could move forward. So I want to underline how very, very hard this work is if you do it at the level that Joyce has admonished us to do. Can you do the last slide, please? Hello, last slide, please. Thank you. Sorry, I was afraid I dropped out again. These are my reflections because I left the department at the end of October of last year. I hope, but I will not represent that they all represent exactly the way people are thinking now. But this is how I came to understand leadership within the context of racial equity. The first is that the issue of racial equity touches all children, all families, and all adults. We can't just put racial justice in a box and pull out every now and then when events call it to our attention. It has to be ever present. People talk about changing the DNA of organizations, and it feels to me like that's an incredibly important point to understand from the start. The second point for me is that racial disproportionality, while it's really apparent within the corrections and the child welfare system, is so clear when you look across categories of service and the data that Joyce presented that we found in Connecticut. So there is really no service sector and no community that is not where you can't find these kinds of data available to you. That requires that we look across systems. The third one is that circumstances like multi-generational poverty, Joyce raised it, and I will raise adverse childhood experience. You may know that a description called ACEs. These add to the challenges of race, and they place children of color at special risk for developmental problems and poorer outcomes. So we need to understand the collective impact of these occurrences on the disproportionality challenges that we face, and we need to understand the high level of correlation among them. The next one for me is that to promote racial equity, leadership can and must engage at all levels of an organization, but, and this is a really big but, I probably should have capitalized it, without leadership from the top, which for me means permission and courage and enthusiasm, and here's the last one, relentless attention, the other efforts are likely to flounder over time. So we need everybody. They can start anywhere, but you really have to have the top leadership to give you those 4 characteristics and allow this to really flourish. The next one for me is that the commitment of an organization to address these issues has to be translated every day, to the actions that are taken by the people who work there in terms of their practices, their decisions, the policies the department issues, and how strong its commitment to public accountability is to release information about how services are, how they work, and how they work differently for children and families who are in different circumstances. And lastly, and this is, I guess, people who know me know this is me, while this kind of step-by-step action is essential if we're really going to change the DNA of organizations, we can't be satisfied with this kind of incremental process, and it can't divert us from the urgency of addressing this incredibly dramatic and pervasive negative impact. So while I know we have to do step by step, I am impatient, and I hear impatience in Joyce's voice, and we'll probably hear it from Gregory as well. Thank you.
Okay, thank you, Janice. We appreciate the work that you're doing and the work that you've done, and then also for participating and sharing reflections today. We'll now turn to Gregory, who will be our last presenter before we will open it up for questions. And so I'll remind people, please submit questions. A lot of you have been doing so. So please submit questions as Gregory is presenting. his reflections, and then we'll open it up for the discussion after that. Gregory?
Hi, Aronde. Thanks so much, and thanks so much for inviting me to be a part of this webinar today. I certainly relish the opportunity to be with my colleagues Joyce and Janice and the folks from CSSP as a part of this this presentation today. I really didn't want to focus much on the presentation that we normally do, which includes a lot of data about the disparity that we're attempting to deal with here in the child welfare and juvenile justice world in New York State with the Office of Children and Family Services. But suffice it to say that the data that has been shared by Joyce and by Janice is reflected in the work that we're trying to do here in New York State, and the challenges are comparable also, with great disparities, very differing depending upon where you are in the state, where children are out of home in circumstances that are sometimes 20 times more likely for a black child than for a white child. And so we are addressing those issues in a very intentional fashion now, and I want to talk about the work that we've done over the last several years to move us to the point where we can say we are intentional, we are committed, and we are about the work. OCFS is an agency that handles services for children, youth, and families and vulnerable adults in New York State. And so we have our early child care with our Bureau Division of Child Care Services. We have a Division of Child Welfare and Community Services where I'm located. We have our Division of Juvenile Justice, which handles our incarcerated population and their post-incarceration circumstances, and vulnerable adults with our Adult Protective Services. And so we span the spectrum of circumstances for children, youth, and families in New York State with a mission to promote the safety and well-being of children, youth, and families in the state. So my presentation really focuses on what we've tried to do from the leadership perspective here to advance this as an agenda for the New York State Office of Children and Family Services, and really have to highlight the fact that we've had support from several commissioners over the course of time, and that's real critical. You've already heard about the need for leadership support from the top of the organization, and I want to just advance the premise that you've got to have leadership work throughout the organization to make this happen and to make it manifest throughout an organization. It's got to be intentional. It's got to be everyone involved in leadership work. And I want to talk a bit about that before I move on. So this first slide speaks to some of the things that we've been able to do during the time frame referenced. This initiative actually goes back to roughly 2002 when some of us stumbled upon the data and began to ask a different set of questions. So the first pin I would stick in this topic is to begin to ask a different set of questions. Leaders don't accept reality, they challenge it and they seek to change it. And so a different set of questions will sometimes get to that. So we moved to a formal agency steering committee from a rather ad hoc informal group that met periodically, sporadically, and with different people at the table. We now have a formal steering committee supported by our executive staff with our acting commissioner in the room when we meet on a regular basis. It has changed the way that we do the work. It's a different level of accountability and a different level of expectation about moving the work forward. Each division has their own subcommittee and their work plans that drive their work. And we developed an agency definition of cultural competence several years ago that we have to constantly refer to and reflect on, because that speaks to the need for us to be culturally competent in order to address this work. You can't do this work without acknowledging the need to be culturally competent, culturally appropriate, and we've heard Joyce and Janice talk about that. We've had race equity training for all of our regional offices and our executive staff. And I'm talking about intense training by Khatib Waheed, who was out of St. Louis, who spent time with us over the last 2 or 3 years working with our local districts and working with our regional office staff and our executive staff for 2 and 3 days at a time to get us to understand that there is a background, a history, a context, and a framework that we need to understand to explain why these disparities exist. It is not just because of poverty. It is because of a history within this country that unfortunately has this work rooted in our public policy, and in the way that we comport ourselves. And so that kind of training was very, very critical for us. We use our data regularly now. We collect data at the state and county level on a regular basis, and we use that to move the work forward. Data will not tell the entire story, but it does help you look at the phenomenon and see very differently what's happening by county, and then we have to get more discrete about that and take a look at what it looks like from a neighborhood perspective. But we are using data on a much more regular basis than we ever have before. And we moved from disproportionality minority representation and cultural competence to the conversations about equity. And so our steering committee is a race, equity, and cultural competence steering committee. Disproportionality can be confused with disparity, and sometimes this notion of minority is an uncomfortable and a cloudy topic to talk about. When you begin to talk about equity, as Joyce has said, you move beyond discussions about minority, you move beyond discussions about equality, which is really sameness, and you look to what you need to do to get each individual, each family, where they need to be to experience the kind of outcomes that we're talking about. And we provided small planning grants for up to 13 counties in the state. We started out in 2009 with about 4 who courageously stepped up and said, yes, we're willing to do this work, we're willing to risk what this could mean for us, but we have to begin to take a look at this work differently, and now we have 13 counties who are engaged with us. There are probably about 29 counties that have high or extreme rates of disparity for out-of-home placement for African-American and black children, and probably close to 20 or so who are in the high category for Latino or Hispanic children, and a few who have that circumstance for Native children. Of the disparities are still very profound for our Native children in several of our counties. I'll go to the next slide. We've had content-specific presentations so that our staff throughout the organization can have a cross-cultural context, or at least a lens for doing this work. We revised our contracting process, and I heard Janice talk about that. We are now asking or requiring people who are seeking money from our agency to tell us what they know about their demographics. In essence, to tell us what they know about their situation and circumstance with all children, youth, and families, and do they have an understanding of the need to be culturally competent and the need to take a look at their circumstance by disparity rates. Very different process for us, but I think the message is very, very important, and it's that we expect those who work with us and those who expect to be funded by us to be aligned with us about this need to be equitable and to be racially competent in the work that we do. We've gotten support from Casey Family Programs that help support our work, and it's not just financial support, but it's their technical assistance and it's their intellect around this that allows us to move this work forward. And of course, national expertise from folks at CSSP and other individuals who are listed on this slide. We are helping to develop a local capacity to collect and use data for this work, so that the counties that we work with can use their own data to drive the work forward. I'll go to the next slide. So we are working in 13 counties now. In 2009, again, we started off with 4. So counties are slowly coming on board. It is a voluntary process, but we have about 3 more counties who have said they'd like to work with us on this also as their disparity rates change. Casey still provides TA and coaching for us. We are considering developing regional race equity learning communities. We want to bring people and entities from the cross-system perspective to the table to have this conversation. I don't want to be redundant, but according to NASA, if you keep saying it, you'll become a genius. So I'll say it as Joyce and Janice have said it. This is not just about child welfare. It is not just about a juvenile justice phenomenon. This issue is a cross-systems concern. And so what happens in early child care is important for this work. What happens in our school systems is critically important, particularly when you see the data on who's being expelled and who's being suspended, and you look at 6-year-old children in some of our communities, 6-year-old children of color being suspended and expelled for things that are normal behaviors in the school. And so we have to figure out how these dots connect, because some of these children, some of these families are entering the deeper end of the system because they're not connecting the dots earlier on. And so these race equity learning communities that are regionally oriented could really begin to have the conversations with our hospital and health community, because they're mandated reporters. And the literature and the data shows that there's disparity in terms of who gets called when toxicology tests are done and come up positive. So we want that to kind of drive the work in a very local fashion. We've had peer TA sessions with our counties where they come together and share promising strategies and practices, very similar to the Casey Family Program Breakthrough Series that was actually the first time I had an opportunity to do this work with Oronde. And we are piloting a racial impact statement now using a termination of parental rights policy that we're looking at. And the whole notion of racial impact statements is really profound for us because we haven't really looked at that as a way to do our work. We spent time talking with Bill in Connecticut and his colleagues, and we're very grateful for their expertise in this regard, because the opportunity to take a look at the racial impact statements and say before a policy gets let out, could this have an adverse impact, a negative impact on certain communities or certain people within certain communities, is critically important if we're going to talk about a racial equity from the policy perspective. And this really is about our public policy framework, our agency policy framework, and then of course, as Janice I think took opinion, the individual practice decisions that we make on a regular and day-to-day basis. Again, another need for ongoing leadership that's indigenous throughout the organization. Rather than waiting for someone to tell us to move, we have to be able and willing to move from wherever we are in the organization, because we all have a stake in this process. I'll go to the next slide. We just completed a DVD of a particular practice scenario that we believe has implications for all of the folks in New York State who are working with this. We'll probably let that out in another month or so. We're staying in touch with our regional offices because they drive the work in the counties, particularly around the child welfare work. And so this whole notion of well-being comes through a regional approach here in New York State. We have 5 regional offices. We have a Bureau of Native American Affairs. They drive our work. They have to be in front of this, and so we're meeting with them to make sure that they're on point and know the body of work. We have regular meetings of that steering committee that I mentioned, and the implementation of a theory of change, which was developed by our executive staff along with our consultant, Khatib Wahid. And so the theory of change was developed by the leadership in the organization, and that's what will drive this work forward as we move into the future. I'll go to the next slide. Let me just do a time check. Okay. The anticipated benefits. We think that reduced placements is a reasonable thing to expect from this, but we also know that reduced placements is not enough. We do, in fact, have a smaller system. We have a smaller juvenile justice system in New York, which was a very intentional effort at juvenile justice reform in New York State, and a child welfare system that is much smaller than when I started looking at the data. But the disparities, unfortunately, in some places are growing, and there are more counties that are experiencing these disparities for out-of-home circumstances for African-American and Latino children. And so we've got to take a look at that. We believe that the cost-benefit and the opportunity to reinvest to do prevention is significant, and we want to make sure that we focus on that. There's an opportunity to get enhanced services, improve our practice, and have more effective policies. Particularly the racial impact statement could have a real implication for that. A workforce that looks to do the right thing. We really are hardwired to try and do the right thing, particularly in this profession. Here's an opportunity for us to take a look at an equity initiative that speaks to racial disparities and the need to find ways to deal with those. And we get to work with underrepresented groups. Our Commission for the Blind found out that there were folks that they were not able to reach, that they used this initiative to begin to do outreach to. And we were able to form new partnerships and collaborations with organizations and emerging CBOs and NGOs that we have not necessarily dealt with in the past, but who are now at the table because there are people who have been looking at this body of work over time and can now connect with a state agency that is in a leadership role with regard to this. I'll go to the next slide. And so the challenges, this really does require a new and different kind of leadership, with a focus on racial justice and equity. And so it requires the intellect and the capacity to engage in the work, knowing what the difference is between equality, equity, disproportionality, and disparity, and what the injustices look like, both in the macro view, what it looks like when it happens in a place like Ferguson, but also in a very micro view of what it looks like when it happens in our neighborhoods and around New York State. And so the leadership work that's being done here requires a constant focus on outcomes for children and families, not just for the benefit of the organizations that we work in. We have to overcome the reluctance, as Joyce said, to hold up the mirror and look at our own practice and policy. And that is a substantial change from some of the leadership work that we've done in the past. It's going to require different supervisory skills and supervisors who are courageous enough to ask the additional set of questions of their staff about whether they've looked at their caseloads through this lens of racial equity. And it requires incredible cultural competence, and we're certainly pursuing that. Last slide, I think, is coming up. and a commitment to measure and monitor, because what gets measured and monitored tends to be what gets done. I think Janice referenced that. We need to target this geographically to areas and families that are most in need. This has to be very prescriptive and very thoughtful and intentional. Data is incredibly important throughout the process. And this cross-system communication with stakeholders and partners we've already talked about. Support with funding in times of scarce and shrinking resources is incredibly important. And at the same time, we need to understand that when we had a lot of money, we still didn't address this body of work in the most appropriate fashion. And so it is not just money or lack of money that will cause us to get to this body of work. We're going to need to be intentional about this and how we train people and even how we establish our expectations. And so again, sticking a pin in the leadership work, leaders establish the boundaries for the work in the organization. And those boundaries are adhered to and manifested throughout the organization by adherence to the values in the organization. And so we challenge people to understand what are the values of the organization and what are the values that drive your work about working with children, youth, families, and vulnerable adults. And if we are measuring our success based upon outcome for children, youth, and families, as well as adhering to our values about what we believe about that work, then we'll be doing better leadership work within the organization. And so it won't just be about money, it'll be about the body of work. And we have to have the skills and the knowledge base to have the critical dialogue that's so difficult in this country that is about race. And so we take a look at what goes on with the disparities that Joyce and Janice have so wonderfully articulated now. Those are racial disparities that we can look at. You know, we have to be able to talk about the history of race and racism, structural, institutional, in this country in order to better understand how to get to the other side of these disparities. That's a skill set that we have to have and a knowledge base that we have to have. Otherwise, we'll stumble about it. And we'll do it poorly, and we know what has happened historically. We've been unable to talk about race and these kinds of disparity, the data that shows us these kind of disparities that we have to contend with. So I want to talk about some of the leadership competencies that I've seen here, and then I want to open it up for any questions that I might be able to help people attend with, and I want to thank everyone for, you know, taking time and being a part of this today. Taking risks is a leadership competency that we need to take a look at, because this is risky. There are political implications with large and small letter P's involved in this. So taking risk, intelligent risk, is going to be a part of this. Developing team leadership, being willing to teach and to learn. Our behavior about this work is so critical, and so we have to model that it's important for us and that we take time to do this work. We as leaders have to set the direction for the organization so that our mission and vision and values take us in the organization in the direction that will allow us to get to these better outcomes. As I mentioned earlier, and it's not my original thought, I did take it from someone else, but leaders don't accept reality, they redefine it. And so on a regular basis, we need to be asking the questions about who and why this work impacts, in addition to how and what we need to do to be impactful. Who and why are critical leadership questions, and we have to constantly keep that in front of us as we move forward to do this work. So I've been pleased to be a part of this. I've been at this work for about a dozen years. I've been in the agency for about 27 years, and I'm looking forward to moving into the future where we can take a look at reducing disparities, getting to equity, and establishing partnerships that maintain this work into the future. So I'll certainly be happy to be a part of any Q&A that occurs now. Thank you so much for your time and your attention.
All right, thank you, Greg, for your work and then also for participating today. Between the three presenters, we really appreciate the reflections on both the substance of administrators' roles and responsibilities within an agency and organization committed to achieving racial equity, and also the qualities, characteristics, et cetera, that are critical in terms of advancing this work. I'm going to turn now and go straight into some of the questions that have come in, and I'm very mindful of time, and so we may go a couple minutes after our stated end time for those who are willing to stay on a little bit longer, but that's, of course, up to you. But just being mindful of time. So the first question that came in was early in the set of presentations, and it came up a couple of times. So first in reference to Joyce's presentation and then Janice, but I'll open it up to the three of you. And so it was really just in the presentations you both highlighted the dynamic of disproportionality and disparities across these systems as it relates to African American children. So the question came up about the place of Native American children within these systems and communities. And if I can expand on that a little bit, I'll also add, so I think part of it is just an acknowledgement of how the dynamic plays out, but then also the unique circumstances of Native American children and families and tribes in terms of the legal status of the tribes and the tribal child welfare system. So the role of leadership in terms of navigating and supporting racial equity also among Native American children and families. But can you all weigh in on that some, please?
This is Joyce, and I would like to just lift up that the importance, especially here in the state of Texas, it's very important because we not only found disproportionality in child welfare for African American children, but for Native American children as well. Although the numbers are very small, it does not negate the critical nature of it compared to the representation in the general population that is very disproportionate. And so I believe that it requires the same level of accountability and commitment at the leadership level to understanding the history and the culture and the, what it takes to ensure equity for this population. And recognizing, again, that it's not about treating everybody equal, but it's about understanding history and the knowledge and the culture in a way that we're fully informed and can do work in a way that will, eliminate the racial disparities that exist for Native Americans as well.
And I'd like to just add 2 words to that. In Connecticut, the population is very, very small, but it's geographically located in one of our 6 regions. And the regional administrator, who's an amazingly fine person, has set about to establish a personal to tribes in order with communication and understanding. So all that Joyce said, plus it takes a special kind of commitment from the geographically engaged in order to make something different.
Okay.
When we work with our Bureau of Native American Affairs, they have certainly been at the table for this work and this conversation and have helped to inform us that there are Native children and families in every single county in New York State, and they go unnoticed. And probably they don't receive the kinds of services, assistance, and support that our systems might provide for them. And when our systems do touch them, there seems to be great disparity when they enter our system in terms of lack of resources and lack of services. But also there's this notion of not being able to identify Native families the way that we need to. And so we need to do a better job of that, because some of the same challenges around asking questions so we can have accurate data are prevalent in terms of our work with all families of color, including Native families too.
Okay. Thank you to the 3 of you. One of the other questions that came in, and I'll actually pose this question to the 3 of you, whoever would like to respond. Can you say a little bit more about the involvement of community members, advocates, and other stakeholders in terms of sustaining this focus on racial equity, especially in the context where leadership within agencies may change every 2 years or more? But can you say a little bit more about the role of community advocates and other stakeholders in sustaining this focus over time?
This is Joyce, and I can speak from my own experiences here in Texas, in that we have had multiple changes in leadership in child welfare since the development of the community engagement model and then bringing the community into this work. And I think what we found is that, the community can be your strongest ally when change occurs. Especially if they have been engaged with you in this new conversation and understanding of that institutionalized racism is the underlying factor that has to be examined in these outcomes. And so a deliberate effort to include them in all of the discussions and dialogues, and an example I will give for Texas is that they were included in our Undoing Racism workshop. So as we grew in our knowledge and understanding of this issue and recognized that it was not solely a child welfare issue, and that actually the answers will come from the communities if we're willing to listen. And if we're willing to be transparent and share in a way where everyone is fully informed, then the community has the capacity to take on a leadership role in this work. And they can be your biggest allies, even those who may have appeared initially to be your biggest critics.
Joyce, I couldn't agree more. I think we need to always keep community at the table, children, youth, and families in the room, physically if we can, certainly advocating for them in all of our policy preparation, and really asking them about what work we're doing, asking them whether or not our policies really make sense. That's a way for us to keep community in this, and quite honestly, as Joyce said, the answers are there in the first and the last case anyway, because when we go our way, community will still be there, and they have always found a way to survive. What we want to do is move to a point of equity so they're not just surviving, and we have to partner with them in order to do that.
I'd like to underline that too and suggest that an observation of mine after sort of 3 times around with space in between in this sector is that we often view community as not helpful and also as service providers. And I think that we could all learn a lot about the natural supports and the protective factors and the assets that exist in community, even communities which are very challenged in all of the ways that we have talked about, particularly economically. I totally agree with both Greg and Joyce that there is an asset base there, and that community understood in that way can be an incredible partner. But I think it's not they that have to change, it's we that have to change in some of the way we do business.
Okay, thank you all. Another question that has come in is, and I'll pose this initially to Janice, but I'll also ask Joyce if either you or Greg want to weigh in. How were members of the subcommittee, in your work there in Connecticut, how were members of the subcommittee selected? Was it voluntary? Were people assigned? Or was it a combination of both? And how was agency buy-in achieved in this work?
I can speak to the first part of that, but then I think we'll have to check in with Bill because those have grown and been built much more robustly in the 8 or 9 months that I haven't been there. But initially we had diversity action teams in our offices, and their role, as they described it to some of us on the leadership team, was pretty diffuse. So when we went through the People's Institute training and when we decided to a policy lens and look at all of our principles and our mission from this frame, it became more clear the roles that they could play, and it was, while it was still voluntary, the structure of the subcommittees that was established with their assistance became clear that that kind of structure was necessary. I don't know, Arande, if the membership now is completely voluntary. I suspect that if it is, it takes a close eye to being completely representative. You know, in the research field, we call these sort of ratified samples, samples of participants. So if it's completely voluntary, I'm sure that the current leadership has looked at being sure that the participants represent the perspective that we hope the agency will take, and also that we're not missing anybody in terms of membership. Beyond that, I would invite everyone to give Bill Rivera either a call, Google him, and send him an email because he can fill you in on the most current detail.
Okay. Thanks, Janice. So I'll move on to one of the other questions, and I'm mindful of time, and so I'll do at least one or maybe 2 more questions before we close. The next question is, and so I'll actually frame this so that it applies to the 3 of you, although it was initially posed in reference to Janice in Connecticut. Can you say more about the relationship between cultural competence, or what cultural competence looks like in the context of procurement and the contracting process?
I can't. That language has been added since I left, although we looked at issues of cultural competence, and initially, I can't tell you what it says now in the contract, but initially we began with an issue of linguistics. accessibility as part of that. So when we looked at the language, the primary language of the folks we were serving, we found that we actually didn't have folks either in our offices sufficiently or particularly the clinical services who could speak the language. The people who, I suspect that they have expanded that with the racial lens, but I'm not going to try and describe something which has occurred after I left.
Okay. All right. Thanks, Janice. Joyce, either you or Greg?
Yeah, what we've asked people to do here for those who are seeking to receive funding from the Office of Children and Family Services is to tell us about the demographics of the communities that they are envisioning servicing with the money, the funding that they want to get. What do they know about those communities from the perspective of who's their race, ethnicity, socioeconomic status? And then what is their commitment to being a culturally competent organization, and what does that mean to them? And so it's requiring them to really begin to articulate with a different narrative perhaps for some of them how they plan to meet these needs of these racial and ethnic groups in the various communities, both from the culture and the linguistic perspective. And then what do you know about these neighborhoods? Because in the past, perhaps people have historically just submitted applications the way that they have historically done that never asked those kinds of questions. And so what one of our staff colleagues here did was to reframe that and ask them to really begin to articulate what they know about the communities from that perspective of race and ethnicity, socioeconomic status, and what is your commitment to being culturally competent as you seek funding from this state agency?
You know, one of the other ways is to ask how they're going to train their staff to respond to a diverse, culturally diverse population of people, so that they can speak to how they're going to do that. But one additional thing that I would say about that that may not necessarily be done in a lot of places is that oftentimes you will see our providers setting up shop outside of the very communities that they need to be inside of. And so some conversation going on, thinking about how do you actually hold contractors accountable for making services accessible to the communities that they're contracted to provide services in. And I would say that that's something that could be looked at in contracting.
Could I add one other word to that? Because I think that's an incredibly important point. And one of the observations that we reviewed all of the multi-millions of dollars that were going out on contracts is that we use a very competitive. And what we were finding was that agencies that were long-standing in a community, often with white leadership, generally male leadership, so gender was an issue here as well, had very substantial infrastructure and could outcompete support organizations that actually lived in the communities, worked in the communities, and came from an asset perspective. So I think agencies, in addition to looking at how they would expect providers to respond differently, they have to look at who they're funding. And if they find that more nascent organizations that actually have outcomes, because outcomes really matter, need some infrastructure supports to be competitive in the contract process, then there's an obligation for an agency, the state agency, to ensure that that happens, because then you'll have a flow of potential providers and contractors who are more competent in the important ways that we've talked about than who we necessarily have right now.
Okay, thank you. I appreciate the three of you responding. Again, I'm mindful of time. We're going to do one more question, and then we'll close. And so the last question, and I'll pose this to the three of you. In your respective agencies, how do you tackle issues of personal bias? In your respective leadership roles, how do you tackle issues of personal bias, staff's ability to recognize and feel safe to share? What practices do you have in place that helps to counteract potential bias within the agency?
This is Joyce, and I would say, you know, part of it is role modeling that at the leadership level, meeting people where they are, and, you know, creating an environment in which people feel safe to share, those things that they may not know or, other people consider to be biased. But creating that kind of environment so that there is an opportunity to, help people to lift up those things both personally and professionally. And so knowledge really helps to give us that courage that we need to interrupt those things in a way where people don't feel like they're being beat down or they have to be really defensive about these things. And so, it's really to seek ways to understand and see those, not just the overt acts, but the covert hidden acts that, we've often become numb to. And when you develop the right kind of relationships, when people are clear that when we're talking about racism, institutional and structure, that we have a common understanding and a common language and a common definition, then people are really okay with somebody even calling them out on some of these issues. Because we know that they come to know that it's not a personal attack upon them, that we have built a relationship that says we're all in this together, and that we may not all be in the same place, but there's recognition and expectation from the leadership level that we all have to be on a journey towards something different than what we've been doing, because what we've been doing has not worked.
I'd like to add to that and take it up to a level of data granularity as well. As our systems reform, the SACWIS data systems we're working with, and as we achieve the ability to do what I will call a microanalysis, that is, look at these practice points specific to an area office, specific to a team and a function, and eventually specific to workers over time, it will show us what I might call hotspots. And that gives the opportunity for learning and supervision and conversation change that is relationship-oriented, but driven by data on actual decisions that people are making.
One last thing that I would say that I did as a leader is, to have this topic on every agenda, no matter what kind of meeting, so that people know it's not a separate body of work, it's part of the work that we're doing. It gives people an opportunity to practice using this new language and getting comfortable with sharing where they are, and being honest is a huge piece of becoming, moving towards becoming a culturally competent, anti-racist organization. Is the ability to be honest and to share and let people know where we are in our thinking and what we're struggling with, but it takes creating an environment for that to take place.
And I think if I could say a couple of things. One, this is about climate shift as opposed to culture shift, in my opinion. And so we're not talking about, the ability to change an entire culture of an organization until you shift the climate, which is a day-by-day decision-making process. So what are you doing today to deal with your race equity kind of work is important. I think we have to be astute, which means we have to be constant learners. And as I take a look at some recent articles that have been written about data and how presenting data to certain groups either can include them and bring them into the work or run them away from this, I have to reconsider how we use data, when we use it. So being a constant learner and seeking knowledge about how to do this work in a more effective fashion is part of the leadership work that can allow the organization to be a safe place where people can find a voice and have a voice and participate in this. And then allowing people to be a part of this with certain boundaries and mandates about it, but also allowing them to naturally find where they fit in this is critically important also.
Can I just say one last thing, Rhonda, and I believe that is that, we will know that we have created an environment in which people know what's expected of them in terms of moving toward racial equity. And we will know when we have that environment, when the people who come to work for us will already know that they fit in, that they bring the right skill and knowledge and concern for equity, and that other people who are not there will know that they don't fit into the organization. And so that's the kind of environment we're working toward where we don't have to, you know, attack people for if they have the real bias, because real bias does exist. You know, real racism does exist. You know, for the most part, I believe that, again, people come to the work to help and not to hurt. But where it exists, we want to have the kind of environment where people know that they can't come into our organization and bring that kind of thinking.
Okay. Thank you. And I want to reiterate our appreciation for Joyce James, Janice Grundell, and Gregory Owens for the work that you're doing, and then also for participating and sharing reflections during today's webinar. I also want to thank everyone who joined today's webinar for the work that you're doing and your commitment to racial equity. It's an honor to be able to support this work and then also to be able to work with Joyce, Janice, as well as Greg in support of the Alliance in promoting racial equity and for children and families throughout the country. So I just want to highlight again for any administrators who are interested in being a part of a new Alliance Social Services Administrators Network, please reach out to me, Orande Miller, at CSSP. And we'd love to have your participation, and so we look forward to creating this additional space for a lot more exchange directly between administrators who are leading this work within their respective agencies. I want to thank the team here at CSSP, especially Jonathan Lights, who's coordinating this year's webinar series, and then always with appreciation to the Annie E. Casey Foundation for their support of the Alliance for Racial Equity and Child Welfare. Please look for an announcement about our upcoming webinars, and so one that we expect during October and then also during November and December. If you don't already receive announcements about the Alliance and the webinar series, you can visit www.cssp.org and visit the Alliance for Racial Equity and Child Welfare page under the System Reform tab. And we look forward to staying in touch with you as we move forward. Thank you again to all of you for joining, and especially to Joyce, Janice, and Greg Owens for participating today. We look forward to talking with you all in the future. Thanks again, and have a great day.